Hi everybody, Dr. Anna here. In this video, I want to explain briefly what a clinical psychologist is. Now, I have realised that there's often a lot of confusion around the title psychologist. What is a psychologist? And that's a really good question because actually the term psychologist is not a protected term. If you've got a psychology degree or you want to use that title, you can. You can just be a psychologist. The psychologists who tend to work in mental health or business or schools or children and families have done much more training and they gain practitioner status by the Healthcare Professions Council. And a clinical psychologist is one of those. So a clinical psychologist is a specialist in mental health and mental illness. In working with people who are struggling emotionally, psychologically, with a whole host of difficulties. That's a clinical psychologist. Now, to become a clinical psychologist, you have to do a psychology degree, and that takes 3 years, obviously. Then many people now do a master's, but you also have to work as an assistant psychologist for a minimum of a year, often 2 years, and that can be in research or in a clinical healthcare setting. And then you have to apply to and get onto, of course, the doctoral programme. And the doctoral programme is another 3 years, and it's incredibly rigorous. You are working in the NHS as a trainee clinical psychologist, and you're in university studying, writing essays, case reports, and ultimately doing your research and your thesis. Every placement is assessed, every piece of written work is assessed. You have to work across a huge range of areas. So everybody works in some adult mental health, child and family, older adults, learning disabilities, sometimes forensic, all sorts of areas of mental health and psychology. And you have to have experience and training in at least 3 types of psychological therapy. Once you've got through all of that, the whole training, you are qualified as a clinical psychologist. That takes a minimum of 8 years. Often it's closer to 10. So to train as a clinical psychologist is a really hardcore, rigorous training. And when you come out the other end of it, you are, very knowledgeable in terms of mental health, mental illness, healthcare, psychology, emotional well-being, all of those areas. The other protected psychologist terms that are registered as practitioner psychologists are educational psychologists, occupational psychologists, forensic psychologists, counselling psychologists, sports psychologists, and health psychologists. All of those are registered and recognised by the Healthcare Professions Council, which is the overall body that registers healthcare professionals. So that is what a clinical psychologist is. That's the difference between someone who calls himself psychologist and someone who calls himself clinical, counselling, educational. Very, very different trainings, very, very different meanings, very different expertises. If you want to work with a psychologist, do make sure that your psychologist is one of those protected psychologists. And when I say protected, I mean registered, actually. So do make sure that the psychologist you want to work for is clinical or counselling or whatever it may be that I've just listed, so that you are seeing someone who has the training required. So that's it. That's what a clinical psychologist is. That's a brief whistle-stop tour of the differences between them. If you've got any questions, please do put them in the comments and ask. I'd be delighted to answer anything. I know it's a funny old area. Please, if there's anyone that you think would find this useful, share it, and I'll see you next time. Bye.